sit over and watch.
Hmm?
You didn't know I had business because I usually just sit over there and watch.
It's true. What do you got?
Okay, we received a check from the state for the depletion, oil and gas depletion trust fund.
Okay.
So I want to let you guys know that. This is, the way I understand it, and Carl kind of talked to me about it, is if the county loses 50% in oil and gas valuation, then the state will authorize us to, we can spend up to 20% of it. But it's only if the state tells us to spend it. They're the only people that can authorize. So we got.
Isn't that usually the case?
Don't get me started.
So I guess the way I understand it, that the state just wants the counties to hold this money on their behalf. I don't know if
In case they want it back.
Well, I figure, I don't know, have people been trying to rob out of this money at the state, so that's why they're giving it to the counties?
I think that was part of the concern. There was a big effort by, I don't remember, they were talking about it to get this money away from the state and up to.
It was $318,809, so it's
I
nice.
remember Jennifer was very excited in Barton County they were going to get this, and I said, well, it's not going to do you
I
any
will
good.
set up that.
Can't spend it. And she said, well, at least the state can't spend
But
it.
that is the whole idea, I think.
To get it
Was
away
to
from
get
the state.
it out of the coffers of the state
Exactly.
and spread it out in the county so
They
they
can't use that to reduce their mills.
No,
No, cannot.
only when the state tells
I know.
us, Nita, can
What
we
about
use
the
it.
interest on it though?
I'm not sure about that. It didn't specify it, but I'm gonna find out. So,
She thought it was possible that we could use the interest
Interest on it.
yeah, I would imagine the county would get the interest, but I'm gonna find out for sure.
and be able to spend it.
Right.
That was her opinion, but she didn't know either, so I'm
Yeah.
not curious.
And when the auditors are here today, I'm gonna ask them that.
Good for you.
Okay, second issue
What was that
is
again, 300? Okay,
$318,809.
that's nice.
So, that was pretty good.
That comes from severance tax. I don't know where it comes from.
Okay, second issue is our slow speed in our office. Last week, we were just really bogged down, so I called the state and said, you know, is the whole state really this slow, or is it just specific to our office? Well, we're still in the process of analyzing it with the state, but they did have me do internet test speeds, and we were at, for download, we were at 1.16 and upload 0.19, which is a snail's pace. So we got in contact with Randy, and he worked with Golden Belt. And on Friday, we did get our bandwidth increased to 6 by 1.5. When we did the test, it was 5.6 by 1.25, which has helped us a lot, but we are still slow.
But that is the most we can get.
But that's the
through
most we
Golden
can get through Golden Belt. So right now I'm in the process of working with the state, and they're going to do some more tests with us to tell us if this is enough or not. Register of Deeds clerk's office and us are all use the same internet, so it might be that we just may put in another internet line for my office specifically, so we don't have so many users on it. Or Randy also said that maybe we need to contact Golden Belt for them to update their equipment, because they have updated equipment in La Crosse and able to get, what, 9 by 3? Do you remember?
I didn't talk to him.
Yeah.
The appraiser's office had to have their separate internet line put in with Orion because they were so slow. And we didn't even think about that for this.
That'll help you.
Well, I'm really frustrated with the state for not, you know, all this time we've thought, oh, it's just, and they did say there still are application issues, but we got to get this variable out of the way first. and then still see if we're slow. And then that's gonna tell the state whether 3M, if the application, the program, there's problems with it still or not. But so anyway, I'm working, but I just want to let you guys know that that might be part of the reason why we are just struggling in our office so much, because we are not keeping up on our work. We're behind, and so.
So is the appraiser using,
The appraiser's on his own line.
He's on his
that's through Golden Belt?
How hard is that to do?
It's a phone call. But it costs more. They're your own separate internet router.
Well, I can see
Every
that
line
you
you
use the
bring.
internet constantly. Do you use it that way?
We all do.
Well, yeah, our movers program is through the internet now, and see, before it wasn't, so. So anyway, that's another issue, but we're working, that they want to do a test, they want to remote in, and they want to document everything, because they got to document everything with 3M, and so we'll see how
So
that
it's at the
goes.
Golden Belt?
If Golden Belt can't get us what we need, then we may have to look at a different internet provider.
And
He
you
just
set
said
up
it
mine
was-
and whatever.
Embark, I was,
Right.
it's just fast.
I talked to Smith County, and he said, oh my gosh, you guys are just sitting there looking at the screen. I said, I know we are. And he has 12.5 by 8 at Smith County. And he said, yeah, he said, that's your problem. You know, you take 3 people doing one transaction in 30 minutes where you could do it in 10 minutes, you're gonna be able to do 3 times as much work. And that's why we're just, so, I'm hoping that's why we can't keep up.
I'm sure, that'd be.
It's gotta be something. So, we're working on that, so I wanted to let you guys know about that too. That's all I have right now.
You guys are up. Come on up. Spin the wheel, fortune.
This is Mackenzie Hudson. Hello. Roger.
Glad to meet you.
Clayton.
Hi, Mackenzie.
JD. Mackenzie's the new director of finance at the hospital. Finance and accounting.
That's it. Title.
If you have an extra one, could I get one?
She can email it to you.
Okay.
Could you read your email? So what you have is May and June income statement. Board approved both of those at the last meeting. May was a $53,000 loss from operations in the month, and June was a $7,000 loss from operations in the month. So at the end of June, the loss for the year is $131,348. Better than last year. So, and we're under budget on most items from the budget that we came up with when I first came to see you guys in October, November area, what we thought it was going to be. So we're under that. Having some issues with having enough nurses to fill all the slots. So we have some overtime, and we've had some agency, and agency costs a lot of money. But we're working on trying to share nurses with other hospitals in the area, see if we can save our agency cost, which is just an expense that you don't really need because it's expensive to have an agency nurse.
And that's where your professional fees come
Yeah.
under that category.
Yeah.
According to your minutes, you hired 2 nurses, so that shouldn't be much of a problem, right? Is that
Depends
what you
on
were
leave,
needing?
medical leave and baby leave and all those things that.
I got a point that benefits are so much, so you had budgeted 115, you're showing 164,000.
Employee benefits was a guess based on what the insurance was going to be. We just didn't know at the time.
Go ahead and talk.
Okay, the next 2 pages are the statistical summary, basically of last year and this year for comparison. And Mackenzie's going to make sure that you get this type of comparison from now on, so that you can see where we are. A bit busier in June than we had been in March and April, not quite as many as in May for actual acute census days. The intermediate swing bed days are down. We had one of our long-term residents move out. Everybody else was pretty consistent. Mostly in June and July, sometimes in August, censuses in hospitals are down. People don't want to have surgery, so they're not coming back to the hospital for rehabilitation. We don't have school, so people aren't, there's no snotty-nosed kids running around spreading germs. If they can avoid the hospital, they do at all costs because usually they're on vacation, etc. So it's down in a lot of places, and that's just part of the issue for being summer.
So the average length of stay is greater this year than it was last year at the same point in time,
Right.
which is good.
Yes. Financially. There's a cap. Your average length of stay cannot be over 96 hours in a critical access hospital. It can go over 96 in one period, but it can't average over 96 for the year. And that's just usually a management issue with physicians. So it's not a big deal when they get close. And that's on the acute side. That's not on the skilled side or on the intermediate side. Then the last pages stapled together are all of the checks that were processed out of the no fund warrant. And if you just start at the very top, it's the check number, the date, who it's to, the dollar amount of the check, and then how many months that it covered. So you can see the very first check covered 3 months. So if you look at this and you see a vendor like the telephone bill and it looks outrageous, it's because it was more than 1 month that we paid.
So now are you current on all your bills now? Everything's current?
And we're gonna,
And you've used all the no fund and it paid all this off? Any excess from the no fund?
well, we paid $567,000.
Okay, I see it on here, okay, I see.
And it was $555.
Yeah, okay, I see.
So I can give you some of the big ones if you want to look through them and come back and ask questions, we can answer that as well. The largest one, EDS, about halfway down the first page, $132,000. That's the state health insurance for the last 3 months of last year.
Doxycare wasn't very cheap, were they?
Nope. Doctor care is expensive.
And you've renegotiated some contracts.
And we're still working on several, trying to eliminate, there's one in particular in the business office that's kind of a middleman between our computer system and Medicare. We don't need the middleman, we can go directly from Medicare to our computer system. So we're working through the contract process, trying to get out of it.
I think every department is reviewing their contracts right now.
That's Clearinghouse and Gray Bend, or
I'm not sure where.
on the Medicare thing?
Yeah, it's the clearinghouse between the two.
Right.
We don't need it, we don't have to have it. We can, we can download directly into the systems, into our system from
Right.
Medicare, and save us so much money.
So I remember that
It's not cheap.
wasn't very cheap.
No.
And it was just something that short-circuited and the claim would bounce back to the origin of the,
Right.
and then you'd go back through them again, and then they'd say it was okay, and then it would go to
Medicare. Right.
CMS.
Right.
Yeah. Always wondered about that.
Some of those claim scrubbers are very good. This particular one happens to not be working very well, and the download function is not working at all. We're spending more time fixing things. And that is probably why cash is having trouble balancing. That's what we've gotten it down to. When you download that information into the system, we're downloading it directly into the cash account for the opposite side of the journal entry. When you do that, it says you got money that you didn't get. Your cash account's never going to balance, because the remittance advice and the cash came from two different people, and they should say the same thing, but they don't always. And what you have to do is go in and reconcile. And if they said they sent you money and they didn't, then you have to call them back and, work the process. It happens all the time. It's not a big deal. You just have to go back through and work the process. Well, when it sits directly into the cash account, your cash account shows that you got more money than you did, and it just keeps changing. So Mackenzie's working on changing the process in which we download the account it goes to, so that cash is only cash, and it's posted as we know we get it, and that should alleviate the issues on going forward, and we should be able to get the cash account to reconcile to the penny. That's the goal.
Can I ask a question?
Yes, ma'am.
So will you just make an adjusting entry for what you didn't get reconciled in the past, or will you have to go back through and get all those reconciled and covered in the past?
Right now, the difference is under the materiality of the threshold of the auditors, and it'll be their discretion. We'd like to do it, but it will take more man-hours to do it than we probably have. I mean, it'll probably take a year to figure that out. We'll go back as far as we can when we get the system fixed. But if it's under the materiality threshold of the auditors, we'll probably just go forward. The last question I have is, did you guys decide on the budget for next year for the hospital?
No, we haven't decided on anything.
Okay. Just chicken.
The whole county.
Oh.
Haven't done anything.
Okay. I didn't know what the process was, so.
We're right in the middle of that, actually. So, your Medicare payment is larger than what you were anticipating back in December, is that correct?
Yes.
Okay, is that reflected in here anywhere?
Yes. Well, it's reflected in last year's financials, because it was for last year. It was an audit entry at the end of the year.
Let's see.
But we have not yet gotten the cash. We'll probably get the cash in the middle of August.
As I recall, you were expecting $50,000, how much?
It was about 187.
Okay, so that money then will be available to help offset the shortage that you currently have?
Yes.
Assuming that this doesn't, that you don't
Yes.
turn this around?
Cash-wise, yeah. It will not go on this year's financial statement. It has to go on last year's.
But it
Because it's
is
related.
available for you to pay this year's bills?
Yes. It'll be in the bank account with all
So
the
really, right
information.
now, you're looking pretty solid.
Mhm.
Yeah, on everything.
You're current, and you have
A little bit of cash in the bank.
a little bit of cash in the bank. That's good to know.
And we're going to try and keep it that way.
Well, there's a lot of people who ask,
Right. I understand.
and they deserve to know, and I thought that was the case, I just wanted to make sure.
Mhm.
So, pretty much what you projected last December when we sat down and made our decisions is where we're at.
And remember, a critical access hospital is not designed to be a profitable entity. I mean, the hospital will never be able to be self-supported. It just isn't. It doesn't see enough people, and the way that it gets paid does not support the volumes that it has. I mean, what it takes to run a hospital for the volumes that you have.
Well, most of all tax boards, aren't they?
A lot, almost all of them somehow. Now, there are some very large critical access hospitals, and they're doing surgery and delivering babies and all those things. And they are probably less dependent on government. You can get some statistics if you want.
Yeah, see that.
I'm just a type.
I've circled that twice now. Right here.
That makes the spelling.
Is it on the stats?
Yes.
Run spell check, Joe. Health fair spelled, fair spelled wrong in health fair.
Oh.
What's one of them? Could you explain what that is?
Healthcare?
No, that's A-I-R.
Oh.
I don't know.
It's mine.
Fire yards.
It's in my world. That was my report.
Not to be nitpicking.
No,
That's all right, I expect that,
Bring
Clayton.
that up, that was great.
So is July looking promising, or
What's the census look like in July?
About the same. I mean, we've had,
Had a couple bigger days.
and we've had a few acutes, so I would say statistic-wise, it's gonna be about the same. Well, and because of the SI patient too, a couple of patients, so it should maintain there.
well, I think you're doing a good job.
Thanks.
The thing that concerned me was some of those contracts that you're able to get out of those, get the people paid off.
We are changing pharmacy vendors and we're changing supply vendors this month. Those are connected and we're gonna go to the VHA Group Purchasing Organization, which should save us substantially on pharmacy and should save us some on the supplies. And that should be done. I think the pharmacy inventory is the 7th or 8th of this month.
So is there a lot more of that that's being pursued, or is there a lot more that can be saved?
There's probably some medium and small, there's lots of small fish, there's probably a few more medium fish like this intermediary in the billing process, and some of that's just figuring out what people are doing and how we can we find somebody who can do it cheaper, same or better service for less money kind of thing.
Well, I was at the at Seward's Senior Citizens meeting the other night, and we had a nice talk about diabetes there, sponsored by the hospital. And I was able to stand up in front of everybody and say, this is what we're talking about. This is the hospital coming out in the county and becoming a community hospital. Can't move the building there, but we can reach out and touch people's lives in this manner, and I think they all appreciate it. Brenda did a good job,
We'll pass that on.
and I think people listen. It's a small thing, but it's kind of like the health fair coming up. And, I said, if you use this, it'll be here. If nobody shows up, what can they do?
Right.
So, good for the hospital, good for Brenda, she did a good job.
Great.
And those are the type of things I think that the hospital can do. And you say a booth at the fair, we're eating pie, just little things like that, you never know. But if it creates a patient or two come up there, my goodness.
Right. Well worth the effort.
And I know a couple people that drive through Great Bend to Hoisington because they don't want a doctor in a bigger hospital and things like that.
Right.
So everybody does ask me this, and I know it's not your, but when are we going to get another doctor? There's just like
It's on the radar, but it's.
I don't know how to answer them other than we have to get our ducks in a row first.
Right.
Are we close to being in a row to the point that they're not you guys' expertise in that?
Well, some of it's going to be financially, what does the doctor want, need, and can the community support another doctor on top of the doctor and mid-levels that are already in the county
Right.
and very close to the county. Because bringing a doctor in and having them fail, not going to do anybody any good. That's what's
There was some talk of sharing a doctor with Brad too.
right, and that is absolutely still on the table. And Dr. Farmer's not a young chicken, so.
I'm sure he'll appreciate you saying that.
Not a super young chicken, and he has no plans to retire that I know of, but he's not going to be around for 20 more years doctoring. And so, find something to come in and help. We'd like to do that.
But it's not actively being pursued at this time, that you know of.
Not actively, no. I mean, the word is out there in the circles. We put it out with the WSU the programs, that if somebody wants to come back to small town rural America, we got a position open. But we're not going to vendor or to physician recruitment fairs or posting ads on websites or anything like that.
I see.
So, anything else?
I just think that, once heat wave is over with and things get back to normal, that, you guys need to go to these communities in the mornings when they are having coffee or whatever.
Okay.
And I think the other thing is that maybe just a thumbnail sketch. And what I'm going to base this on is, and I don't want to be specific, but the salary of a nurse. And we're mandated to have 2 in the hospital 24/7 to keep the emergency room open. Is that correct?
Mm-hmm.
So that's not a very economical price tag there. I know that physical therapists and speech therapists don't come cheap.
Right.
Their hourly rate is pretty high.
We pay them to travel from Hutch.
Yeah.
Still do
And
it.
just the nuts and bolts of the expense. And then I'd also say, if you have a child or a grandchild that's wondering what they're going to do when they go off to college, encourage them to become a nurse or an occupational therapist, or and come back home, because the wages are great.
Mm-hmm.
And it's not that we can pay more or less than anyone else. It's the market.
Right.
$80 an hour for what, physical therapist?
Oh, no.
No?
Not much.
Well, the PRN one that we
Yeah.
You're at 80.
went over that for one of the PRNs that we've had
Then
to
that
fill in
comes
this
under your
slot.
contract, or your professional services, your contract.
We're getting closer to have a PR, well, that was more of a contract, but we're getting closer to having a PRN to help fill the spots that will be a less,
Yeah.
be
But
more
I'm just saying,
comparable, that we have paid over 80.
Yeah, there's no high-paying jobs in these small towns. Well, there is,
Mm-hmm.
if you're the right person.
If you have the right education and
Yeah. And I think that should, it was encouraged, our one little girl that's doing going to school out at Hayes wants to become a dental hygienist. So what?
Right. She can't come back home and find a decent job.
Right. I'll get off the soapbox.
Got anything else, let us know.
All right.
Can answer any questions.
Thank
And if you have any detailed questions or you want more information, just let Heidi McKenzie or I know. Just ask her. And you'll see her from now on. I'll come over.
Oh.
You'll miss us.
I will. I will. You're right. I should might.
Good luck, McKinley.
Thank you.
Thank you. Thank you.
Bye, have a good day, guys.
Bye.
See you later.
What are we supposed to do?
I gave you a copy of the letter. City of St. John requesting that you try to move Joe along with the tax proposals. I gave a copy of this to Joe on Friday.
What if St.
I had no
John
comment
plants to
from
buy any properties like Stafford does and tear them down? They haven't up to now, I don't think, have they? That's, if you have a tax sale, if no one buys it, it's still sitting here. You can't solve that problem. You're supposed to have the sale sometime, And that last time was the property sold. But we can't do anything because really it's just done. So we're just,
And he, like I said, he looked at the letter and
Huh?
didn't say anything. So,
So there's no action we can take, but it has been discussed in open session. We see it, we understand the fund.
and we know,
And I think we've had this
Fully aware of it.
discussion for the last, I don't know how many months.
Yeah.
He brought it up last week, I think, or 2 weeks ago. So, okay. All right, Steve.
The firefighters,
Yes.
county firefighters met with their
Oh, he's
Their,
gonna fill that.
Fire Relief Association issue, and, well, they just met, but they visited about the Relief Association, and the change in revenue received went from 3,500 to just under 15,500.
Very good.
So
that made a
significant change in monies received, and that's just from doing what they always could have done, and that's asking for a reassessment, which should have been done all along, but can't go back and fix old things, but we can do better in the future, which we did. Relative to that, this is a letter that they penned up to you commissioners, and it is just that there's monies sitting in Pratt in an insurance agency that should have gone to the county firefighters association, but didn't, and that is has kind of been frozen, those funds, while it's being looked at. And what they would like and are requesting through this letter is that, and I've spoken with the insurance representative for the state, John Boyd. He said what they're requesting would be considered resolution to the matter from their perspective. And so it seems like a good resolution to go ahead and just move those funds over and call the issue resolved. So relative to that, I went ahead and took the liberty, if you would so choose, and if you'd needed to type something differently, but I just thought while I had it in mind, I actually helped the firefighters write the first one. And so if this is something that would meet with your approval, then possibly we could send this to our legal representative, Joe, and see if he would agree to.
What you're saying here is the monies that was like specifically in Stuart Duncan's name and or his family's name be taken out of their name?
It was in Hudson Fire Department, which the Hudson City Fire Department didn't exist, and so it was in, those monies are sitting in an agency up north in Pratt, I guess that'd be south. They're sitting under that FRA, that Fire Relief Association's name, in people's names that would have been considered to be firefighters under the old days before it actually, the station sold off all their equipment. When it sold off all its equipment, then it no longer continued to be a fire department any longer, which under that situation, then the funds should have transferred over to the county, and then and so that's kind of the basis of why the funds were frozen, because once the trucks were sold off, then those funds should have came over to the county, and so rightfully they are county funds. Now, if there's any other matters related to that, as far as what legal matters Joe might think would be present there, as far as the state is concerned, if we just move those funds over to the county, which is what county Stafford firefighters are proposing, that it would resolve the situation as far as state's concerned. So it seems
So
like
the state's okay with it, the firefighters are okay with it, it's just a matter of getting Joe to pursue this?
Well, or just make that request. I guess with the insurance folks up here.
But the request has to come from
Yes, and I believe it would also probably, as the sitting Fire Relief Association Secretary Treasurer at the time, Stuart Duncan would have to sign off on that also.
there. And if he does not want to,
Then I think it gets back into the legal arena of Joe pursuing legal action. But it sounds like it could be just resolved if they have an agreement between Stuart, I guess, and our county representative. That, and I would think from Stuart's perspective that he would just want to make sure that the legal issues, as far as if there's any penalties or anything, would not be enacted. I don't think that's necessary. I don't think
nobody's encouraging that already.
Nobody's suggesting that.
So once again, we need to talk to Joe and put a bug in his ear, basically is what you're saying.
Yes, and I thought maybe a formal thing of the letter requesting that would be maybe a logical step.
You want to submit this letter then yourself, man?
Well, that would come from you guys. I would think that it would be appropriate to come from you, so I don't know if they need to make a motion relative to sending that letter.
They probably should, just.
Yes, yours, not the firefighter. But you could send a copy of it
Well,
too.
what about the firefighters? Did they sent this letter?
No, that letter is to
It's
you.
to us.
It's to us, I understand.
Yes.
There's no reason why we wouldn't give him a copy of this too, just
No, I
to
think
verify what we're saying here.
That'd be
It
with
says in here that you've attached a copy of the letter.
yeah.
There we go, right there, okay.
Well, I make a motion, we'll submit this letter to the county attorney.
I second the motion.
It's been moved and seconded that we submit this letter from the Stafford County Emergency Services to Joe Shupak. All in favor, say aye.
Aye.
Motion carried. Okay.
This is a truck that was up at Radium. We've had some significant mechanical issues with it, and now it went on fire the other day, and we had some more, and now the rear end's out, and we're looking at $4,600. I think as many problems as it's had, that we should sell it as is. Do not put the $4,600 in it. We would take off the tank and of course all of the back end stuff. I don't know how much, the motor and everything would be okay, so, possibly we could at least get something out of it.
And it's just, was it originally just a flatbed pickup or a truck?
I'm sure it was.
It's four-wheel drive, one of those,
Yes.
probably one come from Saudi Arabia, imagine one of those spectacular they all over.
I don't know where it came from, but it's just nickel and dime just to death. And
Kuwait, I think is where they bought some.
we have one, we've moved the truck from Maxville up to this station, so they're not down the truck. And, but we have one over at Jerry's that's getting replaced, that's getting fixed, and we were actually going to phase one of those out, but we won't. This one, I think, has come on the radar screen as the weakest of the fleet. And we also believe that, possibly this tank, it's up in Great Bend right now. We had to have it towed from the last fire. And we'll look at that tank, but
I saw the tow truck go by, I don't know what you're talking about.
if that tank will work for the newest truck that we have, we'll utilize that. Otherwise, we'll have Nick's working on a couple bids that he'll present in the next week or two if this one won't work. If this one will work, we'll just take this tank and put it on the new one. So if it's fine with you, we'll proceed with disposal of this truck.
What caused that fire, Steve? Because the township guy got blamed for it
Again?
Which I know he didn't.
Not
'Cause
the
he wasn't.
second one, no.
The second one he didn't.
I didn't hear that there was any causation other than, I guess I didn't hear the cause at all. I just assumed that it was, I guess whatever, I didn't hear a cause of it.
Where was the grass?
It started basically in the township, in the road ditch, right? There's a lot of wood and wooded area.
This is dry, it doesn't take much to start a fire right now.
No, it doesn't, but it,
I think you could rub 2 rocks together and start one. It's pretty dry out there. On August the 9th, the evening of August the 9th, 7 p.m., we'll have I need to check with Nita and Missy and see if the annex is open for that evening. If it is, we'll have it there. If not, we'll have it at the EOC. But we're going to do we're required to stay under the kind of the receiving of funds from emergency management, the state, which is passed down from the federal. We're required to do a quarterly exercise. We had already decided, actually, when Matt Neal was here, police chief here in St. John, he had requested that we put on our schedule active shooter, which seems kind of ironic that we'd be doing that right now with the Aurora situation. But that was already pre-planned, and I'd actually held off with the kind of wait until we got to the that's kind of we need to move forward with it. I told everybody because we planned on that in this last quarter and already in the next quarter. So we're going to go ahead and do it, and it'll just be a tabletop exercise, and it'll be, like I said, in one of the two spots. So we're trying to bring the three superintendents together so we can have some commonality of how we're going to respond to something if we should have something of that sort.
I'll have to look and see.
Pagers. I'm trying to find another way that we can contact people. These little silly pagers, they're only about that big, yet they're over $400 a piece. And that's the fallacy of thinking that firefighters don't cost you any money. As far as putting on more and if they don't respond very often, it's very expensive to outfit a firefighter with all the gear, full structure and wildland, and then pagers. But we've got to a point where we're going to have to buy some, and so we're probably looking at buying half a dozen pagers, but I don't have any bids. I just want to give you the heads.
Well, the others just don't work, or what?
They're actually narrowing the bandwidth with all the radio frequencies, and with that, some of our really old ones are going to be obsolete. I'm still looking at, I'd like to, almost everybody carries a cell phone anymore, and I'd really like to work a system that would go through their cell phone, and then we wouldn't have the $425, and if we lost it, we wouldn't have $425 lost. Right now, we have a system of that sort, but it just isn't quite reliable enough. Sometimes it has a delay, it's backed up, and it'll work real great, and then it'll have a 20-minute delay.
That's that alert thing you send out to me.
And it works good for messages that don't have an emergent need. You got, an hour or something, but an hour delay for a fire is not good. Might as well not go. And then the only other thing, I will be out of town, back to the National Fire Academy, leaving this Wednesday, and then I'll be the 25th, and I'll be back Friday evening, August the 3rd. And the only expense for that training, the flight is covered, the busing is covered, the class is covered, and that's advanced public information officer at the National Guard. So the only cost whatsoever for the whole thing is just the food per diem that you have. That's it. I've mentioned that to others. The volunteers have a little more difficulty getting away, but they do have weekend training sessions, and really it's the elite training facility for emergency folks in the nation. And it's in Emmitsburg, Maryland. So we'll try to get some others back there for like a weekend too. And that is all.
I think hasn't Doris gone to something like that?
She went to another one in
Georgia, was it?
in Georgia or something, yeah, there's another one that's kind of like it's a satellite training facility for, and I've never been to that one, but the one back in Maryland is really nice. It was an old nun's college is what it was, and the government bought it, and it's really beautiful. But that's where the Emergency Management Institute and the National Fire Academy are.
So have a good
Talked to
trip.
your
I
neighbor
will.
the other day.
Which one's that?
She was just so proud of you. You put in a smoke detector for her, and then
Oh.
came and changed the battery. She just thinks you're the greatest thing since Dandy. I don't know.
She's a really nice lady. Have you seen her dog? She's got a boxer dog, and he's a real old fellow, and he sits right there in the passenger seat, looking out, just like a human. Okay, thank you. All right.
Thanks, Steve.
Have a good day.
Anything else?
At the moment.
You? Let's recess.
We'll start off with the report, just to kind of give you an overview like we typically do. On page 1, our auditor's report. Just kind of remind you that we're issuing the financials in accordance with the Kansas Municipal Audit Guide, which is a statutory basis of reporting. And we have a clean opinion, which is very good, again this year for Stafford County. If you want to turn the page to go to statement 1 on page 2. Page 2 and page 3 kind of give us a nice summary of our overall beginning cash balance, ending unencumbered cash balance, our cash receipts and expenditures for the year. If you look at the bottom on page 3, you'll see we started the year with $4,569,710. Our receipts, our expenditures, and that we ended the year 12/31/11 with $3,233,984. So we've had quite a dip in our cash balances overall for the county. I think it turned, when I looked at it last night, it's $1,335,726 increase in our cash balances. Sorry, decrease. Yes. The main chunk of that, I kind of picked 2 main funds. One we know about, which is the Special Capital Improvement Fund. That was our annex. You'll see that we started with $1,063,328, ended with $288,725. That is approximately $774,603. We had a decreased cash balance there. The other one that is somewhat of a concern, to say the least, is our general fund, which is the main operating fund of the county. We started with $808,477, and we ended the year with $323,170.
What page are you?
Sorry, page 2.
Still on
Yes,
2?
page.
Okay.
I'm just looking at your general fund.
Okay.
Basically,
Hillary.
We're not talking about the hospital.
I
No.
know.
We will be
She
a
was
little
in
bit,
here
but-
earlier.
Oh,
so,
she was,
yes.
okay. Basically with the general fund, kind of looking at it, quite honestly, a lot of it's just operations. We have increases in employee benefits and the sheriff. You know, when you look at the general fund, we really don't, it's just basically operating expenditures. That's dipping into our cash balance. If you want to look at that further, just turn to page 5, and that's your general fund in detail. By line item, when you look at page 5, the things that stuck out to me are the sheriff, and he even went over his department budget, which I knew we knew about, and then the employee benefits. We budgeted $970,000 for the 2011 budget, and we were over that at $1,014,900. And you can see it's a, you know, it's quite an increase from the prior year, from 2010 also. Also to note, in 2011, we did not make any transfers out of the general fund either to other funds for our reserves. In 2010, we had made $200,000 transfer out. In 2011, we did not make any transfers out to any reserve funds. And we still had that cash decrease.
Yeah, that's a lot.
On page 4, moving back one, just kind of gives a nice summary of expenditures actual to budget with the certified budget for 11 versus actual. We didn't have any budget violations. We were under budget in all the funds. So that's good that we didn't have any budget violations. However, you know, I think with the budget, we always try to allow for additional room just for the unknowns. So, you know, we did have some of those expenditures kind of upped. So, you know, quite honestly, we weren't planning on operating at that level, but in the general fund, we sure did. When I looked at the overall budget, I mean, it looks like we're spending well over, you know, approximately maybe 99% of our general fund budget. And typically that's, we don't like this, you know, we don't like to run in those areas. When you spend 99% of your general fund budget, your cash balances are going to dip. And we're seeing that.
What percentage should that be though?
Well, typically the most we'd like to see, what you say, we keep between 90, around 90% if we, you know, no more than 95%.
Well, you
is
can
kind
build
of-
up a little reserve cash.
Yeah.
Mhm. Definitely not 99%.
Last year, we raised taxes specifically for tax reserves, and you're saying that we're still not going to have
We didn't even
reserves?
transfer any money out of the general fund to our reserves out of our general last year. Because our employee benefit line item went up.
That's primarily the cause.
It's a big chunk of it, yeah. Because if you look at, on the general fund, that additional, we would have still been able to believe, you know, if that would have stayed consistent to the prior year, and maybe we wouldn't have transferred $100,000 out to an improvement, to a reserve fund. Maybe we would have just left it in the general fund. It's hard to say at the end of 12/31/11 exactly what we would have done looking back. But your employee benefits jumping up that much over budget, and then the sheriff, I mean, he was almost $100,000 over his department budget too. And so if we would have had that additional $200,000, you know, looking back, we probably maybe would have transferred $100,000 out of general back to restore the special capital improvement, which is where the annex expenditures came out, and probably left $100,000 in there, I would say, at least into the general fund just to carry over cash balances.
Well, the argument can be made that we're actually doing a very good job because we have enough money to pay our bills, but we're not accumulating money unnecessarily.
That's true. You are doing a pay-as-you-go. And we do encourage all of our municipalities, especially right now with the economy, to pay as you go, meaning store up your reserves, pay for the equipment as you go, don't take capital leases out, because with the capital lease interest rates that you're being charged, you're not earning any near that with the bank, with your cash at the bank. However, it is kind of alarming from our standpoint to see our general fund balance only be $323,170 going into 2012. And what happens if we have another employee benefit, something with our insurance go, and we have another $100,000? You know, if your projections are to only have $150,000 cash balance at the end of 2012, that's not going to be good at all. And I don't know exactly neither, right, where we're at with our actual spending on our general. Are we ahead, behind? Are we running right at target?
I think we're ahead. I mean, last time I looked at it,
We're doing okay?
Mhm.
We're not pushing any line items?
we were okay.
We talked last year about the health insurance, exactly. I mean, it's taking quite a chunk of change.
Yeah, and we examined that and examined that, and we made
It's the best
changes.
deal we
Made
have.
changes.
We changed it some,
And those changes are not, are those changes reflected in this?
Not in that, that's.
They won't be for 11, because when we brought
Yeah,
that
this
up
is
last
for
year when we
11.
delivered.
See,
It'll be next year.
we're a year
Yeah.
behind.
So we will know next year if they, if
Right.
we did
Well,
help.
hopefully, right? Are you on that new plan?
Where we have employees paying more and,
Yeah. So is that helping our line item?
yes, it is. I mean, and we haven't had any big claims this year so
As in,
far.
how have your claims gone?
Yeah.
Okay, that was my
They're,
main
they've
concern.
stayed real low.
Okay, that's good.
So far, so good.
So far, so good.
Yeah, I think I can understand.
So we did make some corrections for
Yeah, we
12.
revamped.
Sure.
that.
So all we're doing now is looking at
Sure.
what really happened in the 11,
Mhm.
correct?
Mhm.
And we knew this.
We knew it was gonna be,
I mean,
Not
last
ready.
year when you sit down,
yeah,
This is-
it
this
was
is
a
what you
somber
were telling
moment.
us.
Yes,
Mhm.
it was.
Yes.
And so we're seeing the effects of that.
okay,
But it's just that I want
but
to
you're
take
not
that.
projecting that for next year. at this
No,
point.
but we're gonna take that into consideration when we look at your budget
I
here in a little
understand,
bit.
okay.
Okay. Okay, thanks, Roger. The rest of these funds, I mean, really, we can go through them in detail if you want to. I really don't have anything of any specifics, although, I say that, here I go. On page 15, if we want to look at the road and bridge fund. This is one item, and I know with the increase in fuel prices and his road mix and whatnot, that we were projecting an increase with his overall expenditures. But we had budgeted $2,063,948 for budget, and he spent within $2,400 of that budget. And if you look at his prior year, he had spent $1,774,217 back in 2010. He did transfer out $56,000, but that is somewhat down compared to what he transferred out in 2010. To have, for a county of this size, to have a road and bridge fund that has $2 million in expenditures is pretty high. I mean, typically, we would see probably 1.8, 1.9, 2 million, I mean, if you, I would suggest, I mean, if we can, and I don't know exactly what we can do, but his expenditures probably should be about $100,000 less, quite honestly. And I know we kind of had this discussion last year. We took it back to him, and he did lower his budget when we were looking at it. But this is one fund, though, that does kind of stick out on the radar. We do have more expenditures than what we typically see.
By typical, you're talking about county
That's all.
population size or area size, and where you use it as a
Well, the
basis?
area, typically a county of population size, quite honestly.
But that's not taking into account how many miles of blacktop we have.
Now, you do have more miles of blacktop,
That's the
but the
problem.
consideration is, though, a lot of other counties, to cut back on their budget, they have gotten rid of blacktop miles and taken it to sand. And there's a lot of counties around here that have had to do that because this fund was eating so much of their mill levy up. I know that's a tough decision to make, but.
We cut back on some, but we still want more of it. We
Yeah.
asked him the other day about maybe getting some traffic counts on some.
Oh, okay,
And
yeah.
see where we could,
Okay,
something
that's
out there
good.
about.
Okay, I just kinda wanted to bring that up, because I mean, it's not like you would be the first county that would have to do that.
So typically, and I hate that word even.
I know, I hate to say on average.
Yeah.
I don't like to say that either.
But you're talking about a 5 or 10% reduction, is that kind of what you're suggesting?
Well, we're looking at mill levy. I mean, when it comes down to cutting expenditures and trying to figure out what we're gonna have to do, this is probably one fund, I mean, I would recommend that we would look at, to be quite
But
honest.
what you were saying, if I want to understand what you were saying, was that typically it would be, typical county would be 5 to 10%.
I hate to say typical, because I have
I
not
do, too. I
compared
don't know
your
what other-
miles, I mean,
Right.
your miles of roads versus.
I don't like the word at all, but
Yeah.
I just want to understand your statement, is all.
Yes.
Population size, just
Population size. And I don't know in the past exactly, I mean, over the years, exactly how many blacktop miles you have cut, if any.
Very few.
Very few. That's what kind of the history I've gotten from Terry. So, I mean, I think historically we've kept on keeping the same roads as far as blacktop miles and stuff.
And of course, there is expense involved when you do let a blacktop go. You've got to grind it up, so.
maintain it.
But on the other hand, the rental of a grinding machine is far less than
The patching and the
1,000
oil.
gallons
That was right.
of
$2.50 a gallon of oil now, too.
Yeah, it's not cheap either, yeah.
But I think we only
We get
ground up 2
Yeah.
or 3 miles.
Since I've been on the board, we just did this one little,
Well, we did,
maybe 2 mile stretch out.
we got here, and then the one over
But
there
it was just too bad to make the road fix. It was just
Sewer that road there, so.
But we do
There's
have
there's 250 some miles of county roads, and we have approximately 200 that are still paved. That's what I remember.
So you know a good majority, wow.
Here to Kansas City.
Yeah, well, basically, we had that
Pretty much.
discussion last year, blacktop, that's right.
So it's a lot of roads.
And blacktop, yeah, that is a lot of blacktop.
And we do have I have those traffic counts. He dropped those by last Friday.
The new,
You know, and our problem is the K9, what we call the K19 extension, 4th Street, those are high traffic areas. The-
Yeah, you do have some.
This Pratt to Ellenwood Road. Then there
Dillon
are,
Road.
yeah. So,
Well, and I credit a lot of that to all of our oil and gas, because
Yeah.
we are an oil
Yeah.
and gas county, and we got a lot of oil and gas
Yeah,
trucks.
when those trucks, they weigh a lot, and you've got,
So,
well, and just trying to get what little crops that are out there harvested, I mean, the semis on those, I know with the road I live on, it's one of the few blacktops
some
First
of the
County
roads that
has
they get-
left. And
beat up and not deep repairable, that's what we're.
is there any other ones you
No,
would
that
like to
was,
talk about?
no, that was
Really?
the main.
Nothing?
Well, I got more, but as
Oh,
far
okay.
as fun, you know me, Roger.
Well, no, I just, thought surely you had something else.
That was all I want to say about the road bridge fund. On page 47, going back to the footnotes. Unless when you guys look through the individual statements, you have any questions, please feel free to ask questions at any time. I just kind of wanted to talk about the statute violations that we had for the current year. That's in note 9 at the bottom of the page, on page 47. Again, these are minor statute violations. It's just some things that we need to work in resolving. We had one Heritage Trust Fund that was not submitted on time. But it's
That's you?
minor.
Oh, okay.
We missed the due date, but she got it filed right away.
It was the day after.
The day
I was
after.
one day late.
Yeah. The game license fees, that's always a fun one. That's a statute I would like to see corrected at the state level. They're supposed to submit them daily. That's a statute violation, yeah, but I think, times have changed with how they are doing the accounts. Basically, the state comes in and sweeps the bank account, so really that statute I feel is somewhat antiquated, but we still have to note it. So, on page 48, this involves our county tax sales. Talking with Lisa about this, we have done the abstract for the delinquent property taxes. It's just a matter matter of the last two that we need to get a tax sale going. And the county has not had one for some time. Do you have any comments, Roger?
No, I don't.
All right.
Yes, but I'm not going to say.
Okay, well, I just thought it looked like you were gonna say something that you didn't.
No, I'm
Okay.
trying to keep my mouth shut.
On note 10, we did footnote the subsequent events with the county issuing $550,000 in no fund warrants for 2012. So, and then basically on 49, then on page 49, our debt schedule. The only outstanding debt that we have is the capital lease that we have on the ambulance until we get the no fund warrants for 2012.
That is considered debt, right? Is that how it's,
Your no fund warrants?
Yes.
Yes.
that shows up on debt?
It'll be on your debt schedule right here next year on, yeah, on this page, on your long-term
And
debt.
it was 555,000.
Oh.
Better to you here.
No, we should have had that, but we had 550,000.
Yeah, it was 555.
Oh.
The attorney had copies of that.
Oh, so the one we have maybe isn't right, because the copy we had was 550, but, oh, shoot.
They had changed it, but you had to,
Wonder which
they just had it wrong on which stuff.
Yeah, that will come
Okay.
to that for some
Yeah.
reason. Just-
Okay. Well, what we can do is we can replace this page of the financial statements if you want us to. I mean, because it really should be 535,000. That's your.
Yeah, I'm sorry, when I looked that over, I
I didn't
notice
catch
that
it
either.
till right now either.
Well, I'm gonna go back and look at the copy we had, because at one point, because did we get a different one for the budget then? Now I'm kind of wondering with our, loan payments on our budget then. If our 4-year period on that's not right.
We're not gonna pay that joker.
Make him eat the 5,000.
Well, it did. He's got, no, in the budget it says 555.
Okay, so unless they're dated one place and we got the updates and not the other, it doesn't look good, okay. Okay,
So we're good on the budget.
we'll take your audit reports back and fix that page.
When is this ambulance paid off?
Your ambulance is paid off, the due date on that is
14.
14.
Yeah.
Because it-
December of 2014.
Yeah.
So we currently owed 80, in other words, that was the beginning of this
The
year.
beginning of,
60,000.
actually at 12/31/11, you have $60,120.
The schedule below shows though.
Gotcha.
Your
I got you.
payables, yeah. Do you have any other questions on the report? On the management and governance letters, I was just gonna kind of go through them when you're ready, and kind of go over the new things for this year. The new items we had.
What?
Those two, the separate
Right,
letters that
right.
you had, yeah, when you're ready.
I didn't realize that the money we gave the hospital was considered a fund.
That originated when did we put that on the tax rolls? 2-3 years ago? 8. When we put that on for the first year of the budget, the commissioners wanted the citizens to know exactly how much money was going out. So we created its own fund to show those appropriations going out, instead of including it just like in the general fund as an appropriation. They wanted it shown to the citizens exactly what was, I believe, Clayton and
Yes.
JD. Okay. And so that's why we set up a new fund and did that. And then, with the no fund warrants, that's gonna be the same way. We're gonna have, that's required, we're gonna have, it's gonna have its own fund, it's gonna be called, no fund warrant fund. That's.
It'd be just like the ambulance lease, you need to show it.
No, it's actually gonna be a separate fund in your
Yes.
table of contents and everything, much like your appropriation going out.
Right.
It's gonna have its own page,
Right.
yeah.
Okay. I'm ready to-
Okay.
You guys ready?
The first letter that was on top is the, what we call the management letter. Down in the middle of the page, we talk about the segregation of duties. We have that every year, just to remind you that we do have minimal staff, which mitigates, which precludes to the issue of, it's like we have one person doing payroll, one person doing all the billing. We kind of commingle between several different individuals. So for the segregation of duties, that's not clear. However, we want to remind that, the commissioners, you are our mitigating factor with that, but we still have to note it. That's why you review the bills, approve them. The next one is that the county does not have anybody on staff that has the necessary skills to draft the financial statements, including all relevant footnotes. We've always had that one in there in prior years also, in conformity with the statutory basis of the county. The purchasing policy on page 2 in the middle, that's also one we've had in prior years. We have more of an informal policy. The last one,
I thought we actually we dealt with that.
I'm working on one, I don't have it.
we don't have one officially, I don't think. we're-
No, I'm in the process of writing one, but an election has kind of gotten in my way.
I see, okay.
Those darn
I
elections.
knew we
Darn.
discussed it.
No.
We also, with the accounts receivable on the EMS, and I know we've kind of discussed this in past, but we would really like collection efforts for the old accounts receivable to be submitted to the Kansas State Set-Off Program to try and aid the county in getting some additional money from those outstanding bills that have not been paid with EMS. Year end at 12/31, we had approximately $224,870 still listed as accounts receivable for EMS. And over 90 days was approximately 200,000 of that amount. So we would like to see uncollectible accounts written off, turned over to state set off, so we can get hopefully some collection efforts on that. Which would in turn hopefully get more money back into the county's operating for the income.
Let's turn around Medicare, payments. My understanding was about 4 months or so.
From the time they're filed to the time you receive the money, I can't answer that.
I think we asked about this, it takes about a while, that's why some of these
90 days.
are more than 90 days, so.
But there's some of them on there though that have been
I've said
there
that,
for.
yeah. Yeah, I know we went through that a couple times, but,
Yeah, we went through that list 2 or 3 times at least.
got rid of, carved off a bunch of old ones, took them off the books.
Those ones that we eliminated, did we go ahead and turn over to the state collection thing or not?
We were never told if they, I don't
You
think
would have
they,
known.
I don't think they've been doing.
Misty would have told you.
Yeah.
We just totally wrote them off then, without even turning them over to them.
The ideal situation, well, and quite honestly, some of them were probably so old that they probably didn't even have the
A lot of them, I'm
information.
sure that the people there was deceased and
Yes.
gone.
Yes, I think that was the
That
case.
lots of
Those
them,
were
I'm sure.
written off.
They were sold.
Because they're.
I don't think she's turned anything over to the state, but I don't know.
typically, we would like to see every 2 or 3 months, preferably monthly. If they hit a certain term, then they present you with a report that's being sent to state set off, is what we would typically like to see for monitoring, so we know what's going on, and so we know that it's being done. And so there's a record of it and approval process. That would be the best case scenario. That's really what should be.
They was for a while, but then bring the reports to us.
Okay. That should probably be a monthly thing. Typically most hospitals, I think of kind of running as a hospital if they're outstanding. They have every month,
I think
they
it's
turn
good to
somebody
have
over to
reports just to
collections.
look at that. So,
In essence.
A monthly report submitted to us.
I think so, I don't know. Absolutely. Awesome.
Improve them being sent off to say self or where, yeah. I think that would be something good to do, just so you can keep it tracking. And so you as commissioners know exactly how much you're potentially writing off for the services for the ambulance. The governance letter, the annual letter comments on that start on page 2. Kind of in the middle of the page there. The EMS fire department, we had the first one last year. It's a repeat from prior year about dealing with the accounts receivable tracking and obtaining training. The second one is a new one with the fee and billing policy for the fire runs. We recommend that we have a uniform policy be established and implemented. We do not have currently a centralized fee, billing, or receipt process established to track the billing or remittance to make sure the county is paid for the runs they're supposed to be paid for. The third one for EMS is also a new one. When the EMS collects revenue for ambulance runs, they really need to be remitted weekly and be accurate coding the deposits. For 2011, that was being done, but it was made known to us that beginning of 2012, with the relocation of the director's office, that is not happening like it was in the past on a weekly basis. Under general matters, the first one with employee evaluations is a repeat from prior year. We already talked about the Heritage Trust Fund. On page 3, the first one is, we had that one last year with vacation usage. The second one was a repeat from prior year, also with the 5 consecutive business days vacation for employees who are involved with the accounting functions. The third one, we went over that in the audit report with our abstract and our need to have a tax sale. The last one, with district court, that was same as last year also. That's a repeat. We still need to get our accounts receivable reporting with district court. We need to get our year-end reports to reconcile. The next one with the grant agreements, we talked about this last year also. We would really like all grant reports be verified with the county clerk and county treasurer before they're submitted to the grant agency to make sure everything reconciles back to the county's books, to make sure that we're filing our grant reports accurately. And then with the game license fees, we talked about that in the audit report. The last 3, actually the last 4 on this page, are all new comments for the current year. We found some journal entries that weren't signed off, and I think it was just they just intermittently got missed. We would just like to make sure that all journal entries are reviewed and approved as they're posted. The monthly reconciliation process for tying the gross wages to the payroll subsidiary ledger and general ledger needs to be done to make sure our 2 ledgers reconcile. And then the third one was the county tax sale. We talked about that in the audit report. Under Register of Deeds, within her software she has, there is a cash reconciliation feature for her cash drawer. and currently she's not using that. At the time we were out here in audit, we would like to see her use that, because that would give us a good monitoring if we have any cash over, under on the cash drawer, and exactly see how that's progressing throughout the year, just to make sure that our cash drawers are balancing and to have an actual record of it with the county computerized reports. That's it for financial bill comments. You have any questions?
So what kind of grade do we get? C minus?
No, I don't know. They're minor things.
Yeah.
It's just that EMS, we've really got to work on that with our collection. To me, the most concerning thing is probably the EMS and the AR and not getting things turned over to collections. And from a fiscal standpoint, I mean, you're doing those services, so why not get paid for them?
It's
If at all we
frustrating
can.
because we tried and tried and tried to do it. And thought, and really thought,
You're okay.
you know, we pretty well led to believe everything was okay.
And I don't know, Nita, at least I hate to put you on the spot, but have things improved since we left? No.
No, you're not good.
I may be getting collections or checks,
To deposit?
yeah, to deposit a little bit more timely now, but, I mean,
Not on a weekly basis.
it's still sporadic.
Sporadic.
Yeah.
Maybe the checks don't come
I
in.
think-
Is that possible?
Well, you can see the
I don't
date on
know.
the checks.
I mean, how would I know? Well, yeah, I can look at the
You
date.
can see the date on the checks and figure out mailing time and.
Yeah. I'll make note of that, and next couple deposits I get, and let you guys know.
But depositing the
But I
checks
have
isn't the
been
real
able-
issue, it's the statement still.
Well,
You got
it's-
too much
It's
out
the
there.
follow-up.
It's the
It's
follow-up.
Follow-up.
And to make sure, I mean, I don't know what the turnaround time is by the time they do the run and it gets billed. I mean, there we would
I
have to
don't
look
know.
at that, and that's kind of hard for us when we go out and do walkthroughs on that to actually tell when that ambulance run was done and when they actually got it in the system. You know, to start the 180-day process, I should say. There might, you know, we kind of probably, you know, that's a concern too. To get it in the system so we can get our check, so we can follow up
Stress
on
that
it.
we won't, that they, when to run, they should
Not only that,
take the time to do
what they needed to be rebuilt, that was probably the biggest thing.
Right,
They weren't-
To follow up on the
the,
AR.
follow up on billings and have some way they could do it
I
in
think
30 days.
that's the main thing.
The main thing is the follow-up, because if you do not
I
get
don't know
that,
whether,
Then, you know, we're gonna end up like
Also,
the hospital,
whether
we've got all
or
this accounts receivable.
well,
No collection.
yeah, that's the concern. I mean, statute violation is very minor, it's just, we have to know that things are running well, it's just that the EMS, we tend to, and there's a lot of fees to be collected, I mean.
Yeah, it's probably just consistency.
Yeah. And that's very hard because their job is to save lives. They're not trained for accounting, they're not, so we're putting them into a role that should not, I mean, that's not their primary responsibility, but yet we need it to be to keep that ambulance on the road. I mean, that's a tough, very tough, I mean, I would much rather make sure they're trained in all their paramedics, especially if I'm, you know, running down the road. Yeah, instead of where they're, are you gonna turn my, you know, bill in? Well, let's worry about that later, you know, I mean, it's, I understand, but, you know, perhaps it would be better if we would probably target somebody that is just there to just do just that and not have them doing runs.
we talked about making somebody part-time out there.
We discussed
My-
that.
my
Having a
biggest money-
dedicated individual
My
that's
biggest money
not.
that has somebody else just part-time doing
That's
something,
not an
billings
answer.
only and follow up on billings and because they was playing to, like you say, they start maybe doing something and get a call, they have to run out the door, they're gone, they
Yeah.
don't know whether they're going back for midnight or what time to get home. Sometimes.
Might actually make you money instead
I think it
of costing
would.
you.
I think that person could probably pay for themselves if they
Yeah,
had
yeah.
the collections up.
But there wasn't enough workload to justify it.
But even part-time?
Part-time, obviously.
It would take, you know, quite a bit of time just to get the AR cleaned up, I think. I think the workload at the beginning is just to
No,
get the AR.
we were in favor of that, I remember that.
Yeah, we talked about being part-time.
And
You can find
I
somebody
remember
part-time.
exactly why we didn't go that way, except thought things were correcting
I
themselves.
thought that, like you say, they didn't think they could have been more money.
Well, it's hard for us to quantify exactly how much of that $224,000 is still collectible.
And how much of it is actually really delinquent? Because you said 90 days, but in reality, it takes 120 to 180.
Well, in reality, I think more of that stuff was over 180 days old. I mean, we use 90 as a cutoff, but in looking at that report, it's definitely
So
on
if we
that.
looked at 180, it would still be that bad.
I'd have to go back and look, but it wasn't. You've had a lot that were still out over 180. I think when we looked at it with you, yeah.
When I was working with Misty, I tried to give her a list that was a year old and say, start working on this, but I don't think she ever did. I mean, I really tried to work with her. And then, I would make her come up and we were doing timely statements. And I'd make her come up to we really, but
Yeah, you're really trying.
yeah. I really tried to emphasize that with her, and I'd give her those bills that were a year old and say, because you can only go out so long too if you don't get it collected.
Yeah.
You're pretty much SOL, so I was telling her to start trying to get these. And I gave Steve a copy of it and said, you gotta get Misty working on these. And I don't know where it went.
I think that maybe with our new financial person over at the hospital and what they told us this morning, that they're eliminating a bottleneck or a glitch in billing, what they've been using a clearinghouse. They look at the file, and if they don't think it's right, they send it back. And I don't know if EMS is used in this same system, in submitting bills to Medicare. So I think with, is it McKinsey? Is the new,
I don't think they use a clearinghouse. I think
They do
Misty
it
does it
in
all
They do it,
herself.
right?
Yeah.
That's what Misty
Well,
does know or something.
we'll look into that and see if we get some of that corrected. Because I know at one time they were talking about the hospital doing the billing,
Never talked
but
about that
that was
last
a year
year.
ago. And they
And I
didn't
don't
have
think that
it.
was an option, at that time.
Yeah, but now they've got a full-time financial person in the hospital, who's a recent hire. And
Well, if you could outsource it, that would be
I made a note of that.
very good.
Work on it.
Thank you, Clayton. Okay, well, if you guys, that's pretty well all I have for the audit, all we have, unless any questions you have before we start talking about the budget.
We adjourn to discuss the budget.
Then go on a workshop.
Yeah, I think we typically do, yeah.
I don't, at this point, I don't have any questions.
Well, this is pretty much cut and dried. I mean, this is the history. And
Yes.
we have to move forward and make improvements.
Well,
Do you want these back?
Yeah, we want the bound copy. Yeah, we want it back, so we change that footnote.
I already changed it.
Can I put my name on this, because I made some marks on it?
Sure.
Oh,
Okay,
yeah.
you just want to put
I
your
made
name on.
marks too, yeah.
Okay, yeah. Change that one page out.
Well, let's adjourn. They move on this ship.
Your adjourned.
I'm adjourned.